I'm Ashtyn Hiron, joined by Tim Oldham, CEO and Managing Director of AdAlta. Thanks for your time today. There's been an interesting discovery regarding protection against malaria. Could you tell us about that?
Our collaboration with Trobe University has resulted in this, what we think is a world first discovery of an antibody that actually binds to all strains of malaria and can inhibit their invasion of both red blood cells and liver cells with really high potency. So this has the potential, we think, to potentially break the malaria life cycle in at least two places, which would be a pretty unique outcome.
Is there much known around the science of malaria prevention and treatment, and how do you think AdAlta stands out in this?
There are 250 million cases of malaria still around the world today, every year. There are more than 600,000 deaths from malaria still every year. And we've started to see in the last couple of years, we're seeing the local transmission of malaria in Europe and now in 2023 in the US. So this is a disease that is no longer being confined just to tropical and developing countries. It's a big deal and becoming a big deal in many other places as well. We know that malaria parasite is highly variable, that the pathways and the receptors that it uses to invade human cells vary quite significantly, which is why there's so many strains of malaria. It's also why malaria parasites are able to generate resistance against anti-malarial drugs. And so, we've seen that many of the drugs we were using, certainly when I was traveling 20 or 30 years ago, don't work anymore because the parasite has generated resistance. So what we've been able to do for the first time is find an antibody that does two things, an antibody-like molecule that does two things. First, it binds with really high strength to all forms of malaria. Traditionally, we've been able to find antibodies that bind to a single or a couple of variants, but not to all of them. This antibody binds to all variants of malaria that we've tested so far. And secondly, it's also a high potent inhibitor of malaria invading red cells and liver cells at two stages of its life cycle. So that combination of high potency and pan-species is the unique thing that's never been achieved before, and that we think is potentially got interesting applications in treatment and or prevention or prophylaxis of malaria.
It's an incredible discovery. Just going back to the collaboration you were telling us about earlier with Trobe University, how do you think this benefits AdAlta's deliverables?
Okay, collaboration with Trobe enables us to do things that aren't core to our business. It really enables us to explore the whole potential of this really powerful drug discovery platform that our antibodies represent. Internally in our core programs, we're very focused on taking our 8214 antifibrotic program forward into phase 1 and now towards phase 2 clinical trials. We think there's a really important application in the field of cellular immunotherapy, and those two platforms are really about all we can usefully and productively and efficiently accommodate in-house. But we know there's so many more things that these antibodies can do, and so our collaboration with La Trobe allows us to explore those and really demonstrate the potential of the antibody platform at very, very low cost to ourselves. And this discovery in malaria is a great example of something we'd have never found internally, but we've now found through this collaboration.
And I guess on a wider view, Tim, how is the company looking to explore its potential given this discovery?
So our core focus remains as a company on progressing our lead asset 8214 through the last stages of its phase 1 clinical extension study right now and into partnering to fund the phase 2 program. We continue to work with our collaborators in the CAR T cell therapy space, and those two priorities are the big priorities for our current funding arrangement. So what we'll be doing with this malaria discovery is continuing to work with our colleagues at La Trobe University, seeking additional grant funding or industry partnerships that will fund the ongoing development of this program. We're actually fortunate that there are a number of tropical diseases funds through the NIH, National Institutes of Health in the US, the World Health Organization. So there are a number of, and the Departments of Defense, frankly, as well. So there are a number of places where there's a higher probability of securing grant funding for this type of research than perhaps for some of the other targets we might work on. So that's the focus for us from here.
Lots to look forward to, and we look forward to following your progress. Thanks so much.
Thanks, Ashtyn.